This is a presentation on chickenpox by Brittany Wills. Chickenpox is caused by the varicella zoster virus. Chickenpox was once a common childhood infection before the production of the varicella vaccine. Chickenpox usually will clear up on its own, but serious complications, including death, have been reported. About 1 in every 100 children who had chickenpox developed pneumonia, encephalitis, or problems with their liver. Skin infections often occurred as well due to bacteria that entered the skin from scratching. Before the vaccine, 100,000 people were hospitalized and 100 people in the United States died from this each year, says Harvard Health. And there's a picture of what a chickenpox rash may look like. Chickenpox is characterized by an initial fever followed with a rash a few days later. A loss of appetite, headache, and malaise is also reported. The rash develops into red, fluid-filled blisters that are very itchy. They are raised and usually easily recognizable as the chickenpox. Chickenpox goes through 3 phases: raised bumps that turn into blisters and then crust over and heal up. The rash begins on the head, face, and the trunk first, and then moves outwards to the arms and the legs. Blisters might also appear inside the mouth, nose, throat, and even the vagina. New bumps will continue to appear for a few days, so the individual can be in all 3 phases of the chickenpox at one time. The physician should be notified if the rash spreads to the eyes, if the person gets dizzy, disoriented, has tachypnea, gets short of breath, loses muscle coordination, develops a cough that doesn't get better or gets worse, vomiting, stiff neck, or a fever above 103 degrees. If the rash gets very warm or red, this could indicate a secondary infection, and the physician should definitely be notified. Symptoms usually occur 10 to 21 days after the individual is exposed. Chickenpox is spread from person to person through direct contact and is most contagious the day before the rash appears. However, it can be spread up until every blister has crusted over. Chickenpox is a virus, which means you can get it if you touch a blister, the fluid from a blister, or through droplets such as when a person coughs or sneezes. A pregnant lady can also pass chickenpox to her baby before birth, as this crosses the placenta, which can sometimes lead to severe problems. Chickenpox in pregnant women can become severe very quickly, and she should notify her physician immediately if she suspects chickenpox. The varicella vaccine was approved for general use in 1995 in the United States. It is now recommended for children 12 months or older. It includes 2 doses needed for the varicella vaccine. The first dose is given to children between 12 and 15 months, and the second dose is given to children at age 4 through 6 years old. However, the second dose may be given as early as 3 months after dose 1 for children up to 13 years of age. The vaccine is a live attenuated vaccine, so it isn't recommended for people who have weakened immune systems. It is recommended that all healthcare personnel be immune to varicella due to the increased risk of chickenpox and shingles. Shingles is another infection that looks like chickenpox and is caused by the same virus. The difference is that it usually appears on just one part of the body and it can be very painful. Chickenpox can cover the entire body. Shingles can occur years later in individuals who have already had chickenpox. It is very contagious and is spread through direct contact with secretions. A person can contract chickenpox from someone with shingles, but cannot get shingles from a person who has chickenpox. And there's a picture, chickenpox versus shingles. And here is the stages of chickenpox. First stage is the incubation period. Usually lasts 14 to 17 days. The prodrome stage is 1 to 3 days. And then here comes the rash, the vesicles, the pustules, and then the scabs. And the recovery typically is 7 days after the rash appears. The best way to prevent chickenpox is to be vaccinated. However, if someone contracts chickenpox, the best way to treat it is the same as any other virus. Take good care of the skin, try not to scratch, and your provider can prescribe a medication such as Benadryl to reduce the itching. Oatmeal baths and calamine lotion can also help reduce itching. Acetaminophen can be used to reduce fever, and be sure to keep the infected individual away from other healthy individuals. Your provider might also prescribe an antiviral medication for severe cases or people who are at higher risk for complications. Chickenpox was previously known as an infection that pretty much every child would contract. Most of the cases were mild to moderate, but there were some reported cases that were severe and led to serious problems, especially in adults and people with weakened immune systems. I myself had chickenpox as a child. I remember how extremely itching and annoying it was. I remember taking like 3 oatmeal baths a day, and I was so glad to see it finally heal up. The goal for treatment for chickenpox is to protect the skin and pretty much let the virus run its course without it doing detrimental damage to the body. Thanks to the varicella vaccine now, chickenpox is far less common. Adults who had chickenpox as a child can develop shingles years later due to the virus laying dormant in the body, and this can be reactivated at any time